Prodige 24, presented at the ASCO annual meeting, in 2018. This was a multicenter international randomized phase 3 trial of adjuvant modified FOLFIRINOX versus gemcitabine in patients with resected pancreatic ductal adenocarcinomas. This phase 3 study evaluated patients 18 to 79 years old with pancreatic ductal adenocarcinomas, 21 to 84 days after R0 or R1 resection. These patients had to have a WHO performance status of less than or equal to 1, adequate hematologic and renal function, and no cardiac ischemia. With a median follow-up of 30.5 months, the median disease-free survival was 12.8 months in the gemcitabine group, versus 21.6 months in the FOLFIRINOX group. The median overall survival in the gemcitabine group was 34.8 months, versus 54.4 months in the FOLFIRINOX group. The median metastasis-free survival was 17.7 months in the gemcitabine group, versus 30.4 months in the FOLFIRINOX group. The authors concluded, adjuvant modified FOLFIRINOX is safe and significantly improves disease-free survival, metastasis-free survival and overall survival compared to gemcitabine. Thank you for watching.